Bismillahirrahmanirrahim. In the name of Allah, the most gracious, the most merciful. Quote of the day: mistakes are a fact of life. It's the response to the error that counts. Assalamu alaikum everyone. I'm Dr. Mahnoor, PGI in Department of Community Medicine. Today I'm going to present the three parasites under the communicable diseases: roundworm, whipworm, hookworm. And this presentation is going to be presented under the kind supervision of our worthy professor, Dr. Saira Afzal. In this presentation, following aspects of roundworm, hookworm, and whipworm will be included: introduction, global burden, epidemiological triad, clinical feature, diagnosis and treatment, prevention, and recent updates. At the end of presentation, participants would be able to describe roundworm, hookworm, whipworm, along with their levels of prevention. These three worms are the soil-transmitted helminthes because the infection spreads through contaminated soil. So we're gonna start with roundworm. Its scientific name is Ascaris lumbricoides. It is a case presentation. A 12-year-old boy from periphery of Lahore was admitted to emergency department of Mayo Hospital with acute colicky parumbilical pain, not referred to other side, vomiting and constipation for 3 days. On physical examination, had pallor, appeared poorly nourished. His oral temperature was 37.5 degrees Celsius, blood pressure 100 by 60 millimeter of mercury. Pulse was regular and rate was 120 beats per minute. Respiratory rate was 35 breaths per minute. Abdominal examination revealed abdominal tightness and rigidity in the central and mid-abdomen. There was no organomegaly. At the time of admission, laboratory investigation were done. The RBC count were 3.4 to 3.8 into 10 to the power 6 microliter, and hemoglobin was 10 gram per 100 milliliter. The total leukocyte count was 13 into 10 to the power 3 microliter. Eosinophil count was increased, which was 12%. Abdominal ultrasonography demonstrated parallel paired lines with railway tracks in the intestinal lumen that was suggestive of worm. The boy came from very low socioeconomic status. His father was farmer, and the family had the father usually spending all the day working in the fields. They usually ate vegetables from the field without washing. The boy had a history of pica. The lumbricoid infection was suspected at the patient mother gave a history of expulsion of one very big worm from the ear shortly before coming to the hospital. So this is a depiction of Ascaris lumbricoid. Introduction. Ascaris lumbricoid is the largest nematode. It is an intestinal worm found in the small intestine. They are more common in children than adults, and 500 to 5,000 adult worms may inhabit a single host. Global burden. The Ascaris lumbricoids infection happen all over the world. The eggs from the parasite passed in the human feces can contaminate the soil. The eggs survive best in warm places. So in tropical, subtropical areas of Asia, Sub-Saharan Africa, and the American is the habitat of this parasite. The global burden of Ascaris in 2019 was 7,54,000 deaths per year. An estimated of 807 million to 1.2 billion people in the world are infected with Ascaris lumbricoids. Epidemiological feature. As we know, the epidemiological triad consists of agent, environment, and host. So agent, Ascaris lumbricoid live in the lumen of small intestine where it moves freely. Sexes are separate. Female measures 20 to 35 centimeter, while male 12 to 30 centimeter. Reservoir of infection is the man, and infective material is the feces containing the fertilized egg of the parasite. Host infection rates are high in children. They are most important disseminators of infection. Adults seems to acquire some resistance. There is high degree of host parasite tolerance. Roundworm rob man of his food and may possibly compete for the vitamin A in intestine. They contribute to nourishment, especially in children who may show growth retardation. Environment. Ascaris are soil transmitted helminthes. The eggs remain viable in soil for years under favorable condition. Clay soil are more favorable for development of Ascaris egg. Seeding of soil by Ascaris egg take place by human habit of indiscrimination open air defecation. It is almost important factor responsible for the widespread distribution of Ascaris in the world. Until the fertile females are there, the period of communicability exists. Incubation period for this parasite is 18 days to several weeks. Here's the life cycle. So we're going to start with step one, where the adult helminth Ascaris lumbricoid is in the intestine of human. It is passed to the soil through the feces and passes through multiple stages to become the adult. Then it can be ingested by the human or can go to the lungs through uh, uh, sputum, and through blood it can from intestine it can also can be embedded in blood and can go to the lungs, and through lungs it can be regurgitated back towards the mouth and can be re-ingested. So the whole life cycle includes the human intestine, soil, and the respiratory system. So clinical features, people show no symptoms. Lung phase, there is the Ascaris pneumonitis, which will be presented as coughing, wheezing, shortness of breath, can't be diagnosed at that stage. In intestinal phase is also weak to severe abdominal pain. There is nausea and vomiting, weight loss, malnourishment, diarrhea, and bloody stool. Complication can be in form of gallstone, pancreatitis, or intestinal perforation in severe cases. For diagnosis, the stool examination is done for seeing the adult form, the sputum examination for seeing larvae during the migration in lung, and is eosinophilia are also indicator of parasitic infection. But eosinophilia is not specific for the Ascaris lumbricoides. It is generally elevated in parasitic infection. In treatment, medication and drugs that remove the parasitic worm from the body is given, which are we know the antiparasitic albendazole and melbendazole. The drug for it is the drug for choice, and it is given for 1 to 3 days. So how can we can prevent the Ascaris lumbricoid infection? Avoid ingesting soils that may contaminate with human pig feces. Wash your hands regularly by washing hand with soap. Teaching the children the hand hygiene. Supervising the children around the pigs. Wash, peel, or cooking the vegetables thoroughly. Transmission of Ascaris lumbricoides infection to others in community setting can be prevented by not defecating outdoors and effective sewage system. So the second parasite of our discussion is hookworm, and its scientific name is Ankylostoma duodenale. Here's the case presentation. A 54-year-old male was admitted because of having suffered from progressive watery diarrhea for 12 days. He had no history of diabetes, mellitus, hypertension, heart diseases, organ transplantation, or malignancy. After admission, he still complained of diarrhea along with anorexia despite medication treatment. The laboratory examination showed leukocytosis, eosinophilia, and a stool examination by concentration method was negative 4 times. When sigmoidoscopy was performed as a part of an explorative survey, a single protruding mass consisting of a moving adult hookworm was found. The fifth stool examination by concentration method identified the hookworm ova. The patient was treated with oral melbendazole 100 mg twice a day for 3 days. The diarrhea and eosinophilia subside after this treatment. So it was the case presentation of hookworm. Hookworm belong to the family of Ankylostoma, are parasite nematode that infect human. Infection tropically occurs through the larva penetration of skin, often via contact with contaminated soil. Once inside the body, the larvae migrate to the intestine where they mature into adult form. This parasitic activity can lead to anemia due to blood loss from intestine. Endemic in tropical and subtropical region with poor sanitation, hookworm pose a significant global health concern. Almost eradicated from Europe and USA. Hookworm infection is still seen in warm, moist climate in tropical, subtropical regions, for example, Asia, Africa, Central and South America. Worldwide hookworm infection and estimated 576 to 740 million people, although most of those affected are asymptomatic. Agent for hookworm is adult worm live in small intestine, mainly jejunum, where they attach themselves to villi. Male measure to 8 to 11 millimeter, while female 10 to 13 millimeter in length. Eggs are passed in feces in thousands. Reservoir is the main infected material feces containing the ova of hookworm. Period of infectivity is as long as person harbors the parasites. Host factor, the first one is agent sex. All ages and both sexes are susceptible to infection. In endemic area, the highest incidence of is found in the age group of 15 to 25 years of age. Nutrition studies indicate the malnutrition in predisposing factor. The chronic disabling diseases does not occur in otherwise healthy individual. Host parasitic balance in endemic area, inhabitants develop a host parasitic balance in which the worm load is limited. They harbor the parasite without manifesting clinical signs and symptoms. Occupation, it is to be expected that hookworm infection will have a higher prevalence in agriculture than in town workers, and in many tropical countries, it is an occupational disease of farming community. So it is a life cycle of intestinal hookworm. We're going to start it with the eggs in feces, which is the step one. Then these rehabilitative form larva hatches, and this converted into adult worm, which penetrate the human skin, mostly through foot, which are contaminated in the soil, and from there it becomes a part of bloodstream and then goes to our gastrointestinal system and habitate over the small intestine, mainly in jejunum. Clinical feature of hookworm symptoms, dermal are local erythema, macules, papules, in pulmonary bronchitis, pneumonitis, sometimes eosinophilia. When it comes to gastrointestinal tract, there is anorexia, epigastric pain, and gastrointestinal hemorrhage. Hematological symptoms are in form of iron deficiency, anemia, hyperproteinemia, edema, cardiac failure, etc. So diagnosis, the standard for the diagnosing presence of hookworm is identifying the hookworm eggs in stool sample using a microscope. Treatment, and helminthic medication, antiparasitic medication like albendazole and bendazole. Iron supplements are also given as it causes a malnutrition. We can prevent this infection by improving the sanitation practice to reduce soil contamination, ensuring the access to clean water, encouraging the consistent use of footwear, educating the communities about the proper hygiene practice to prevent infection, implementing mass drug administration program to treat infection. We're gonna discuss mass drug administration program at the end of this presentation. So, third entity of our concern is Whipworm, which is known as Trichuris trichuria. So here is a case. A 7-year-old boy was brought to the emergency department from one of the remote areas of Sindh with complaints of increased stool frequency, about 12 to 14 stools per day, along with mucus, blood in stool, followed by some protrusion of anal masses. Laboratory tests showed mild eosinophilia in blood test. The patient submitted a fecal sample which was concentrated and examined following standard laboratory protocols. There were no worms in the feces, but the examination with iodine wet mount showed the presence of yellowish brown egg with two polar plugs and resembled trichuris. The average size of egg was 90 micrometer in length. Based on this finding, this case was diagnosed as yes. So, whipworm infection, also known as trichuriasis, is an infection of large intestine caused by parasite called Trichuris trichuria. It is third most common soil transmitted helminthes. The whipworm infection can develop after ingesting water or dirt contaminated with the feces containing whipworm parasite. In morphology, the adult worm resembles the whip. So it is called whipworm. The anterior 3/5 of the end is very thin hair-like, and the posterior 2/5 of the is thick and stout, resembling the handle of whip. The anterior end penetrates the mucosa layer and remains deeply embedded. Uh, Most of the disease burden is seen in tropical climates, specifically in Asia, and less often in Africa and South America. Uh, about 450 million to 1 billion active cases, with most diagnosed in children. Worldwide, almost half of the 5 million people that live in developing countries are infected with at least one soil transmitted disease. Young boys tend to be more affected as they are more likely to play outside. Here's the life cycle of whipworm. We're going to start with the eggs in the soil, which went to the two-cell stage and then advanced to the cleavage stage. Then they embryonate. Eggs become infected in 15 to 30 days after ingestion. Soil contaminated water or food, it goes in intestine, and it get it makes its habitat in large intestine. In clinical feature, they are mostly asymptomatic. Physical weakness, anemia can be seen. Stunted growth, cognitive deficits can be seen in children who are, infected with this parasite. Stool frequency could be 12 plus stool per day. Nocturnal stooling, trichuriasis, dysentery syndrome can be developed. They can be colitis, and rectal prolapse can also be seen. Incubation period of this parasite is from 60 to 90 days. Trichurious dysentery syndrome can be found in children with no adult cases noted, and is seen when there is a very high worm burden. This often leads to diarrhea, tenesmus, iron deficiency anemia, poor growth. The poor growth is typically secondary to poor nutrition and consequently causing the cognitive delay. We can diagnose it by a microscopic examination of stool. The characteristic lemon-shaped egg with clear operculum at both ends are readily apparent. We can see this in picture 2. When endoscopy is and proctoscopy, anoscopy, proctoscopy, or colonoscopy is done, for other indication, wiggling adult worm may be seen protruding into the bowel lumen. Like other parasites, we also treat it with albendazole, mebendazole, and ivermectin. The suggested dose of mebendazole is 100 milligram twice a day for 3 days, or albendazole is 200 to 400 milligram twice a day for 3 days. We can prevent it by avoiding the contact with soil, by washing hands, teaching children to improve the washing hand and preventing the infection. Wash, peel, or cook all raw vegetables. More on hand washing. Transmission of infection to other can be prevented by not defecating outdoors and effective sewage disposal system. So we're gonna discuss further the protocols of antihelminthic drugs in pregnancy, lactation, and pediatrics patient. Albendazole in pregnancy. Data on use of albendazole in pregnant women are limited through the availability of evidence suggested no difference in cognition abnormalities in the children of women who were accidentally treated with albendazole. In mass prevention campaign for which the World Health Organization had determined that the benefit of treatment outweighs to risk, so we can safely use it in pregnancy. WHO allows the use of albendazole in pregnancy, but in second and third trimester. It is not known whether albendazole is excreted in human milk, so it is safe in breastfeeding women. The safety of albendazole in children less than 6 years old is not certain. Studies of the use of albendazole in children as young as 1 year old suggests that its use is safe. According to WHO guideline for mass prevention campaign, albendazole can be used in children as young as 1 year old. Many children less than 6 years old have been treated with this campaign, and there was no side effect. So the second drug which is mostly used is mebendazole. WHO allow use of mebendazole in second and third trimester. In lactation stage, the mebendazole is compatible with breastfeeding. There is limited data in children aged 2 years and younger. Mebendazole is listed as an intestinal antihelminthic medicine on the WHO model list of essential medicine for children, intended for use of children up to 12 years of age. Preventive chemotherapy for soil-transmitted helminthitis in developing countries, group at risk of soil-transmitted helminthic infection are treated with preventive chemotherapy. Preschool and school-going children, women, and childbearing age, and the adults in occupation were their high risk of heavy infection, so they are treated with this therapy. So, mass drug administration, a soil-transmitted helminthic, lymphatic filariasis are some treated through mass drug administration. Drug used are safe and inexpensive. Commonly, drugs used and people go door to door for this administration. WHO recommendation medicine for medicine is albendazole, which we discussed the dose previously, and the mebendazole. In recent updates, the global target for 2030 global targets of soil-transmitted helminthitis is to achieve and maintain the elimination of soil-transmitted helminthitis morbidity in preschool and school-age children, reduce the number of tablets needed in preventive chemotherapy, increase domestic and financial support to prevent chemotherapy, establish an efficient a control program in adolescent, establishing an efficient, strongly resist control program in school-going children, ensure universal access to at least basic sanitation and hygiene by 2030. These are the sustainable developmental goals. Baseline survey report of soil transmitted helminthes prevalence in Pakistan. This survey followed WHO guideline and used the Sentinel School method and ecological zone to determine prevalence. Much of the southern region of Pakistan is free of STH, with the notable expansion southwestern Sindh centered around the Karachi area and extended into the limited area in southeastern Balochistan. Soil transmitted helminthes is mostly confined to northern areas of the country with highest prevalence focused in the area around the Rawalpindi and Islamabad. So now the MCQ section. MCQ number 1 is an 80-year-old boy was brought to pediatric OPD for a very remote area of Punjab with complaints of anorexia, nausea, vomiting, along with abdominal pain. On examination, there were rashes all over the body. Her mother also complains his issue of pica. Which of the following could be the causative agent for his condition? A. Ascaris lumbricoid. B. Nectar americanus. C. Ankylostoma duodenale. 3. Trichuris. E. Entamoeba histolytica.
B.
The answer is A. Ascaris lumbricoids. Each of the following statement concerning Ascaris lumbricoid is correct, except A. Ascaris lumbricoid is one of the longest nematode. B. Ascaris lumbricoid can cause pneumonia. C. Both dogs and cats are intermediate host of Ascaris lumbricoid. Ascaris lumbricoid is transmitted by ingestion of eggs. E. Ascaris lumbricoid are known as roundworm.
A.
Answer is C. Ascaris, both dogs and cats are intermediate host of Ascaris lumbricoid. It is incorrect. Human is the host. Which of the following is not correct regarding soil transmitted helminthic infection in pregnancy? The infection could be determined during pregnancy due to the maternal anemia. B. The treatment should be withheld with delivery because of the adverse effect on baby. C. The treatment can be given in last trimester of pregnancy. D. The benefits of treatment are greater than the adverse effect of treatment. E. The severe form of infection causes iron depletion and anemia. Answer,
B.
yes, answer is B. And figure number 4, which of the following element enters the body of a man through the skin of his feet if he walks barefooted in the contaminated soil? A. Ascaris. B. Ankylostoma. C. Schistosoma. D. Vaucheria. E. And amoeba histolytica.
C.
A.
D.
D. Answer is B. Roundworm infection is the most common type of worm infection in the world, mostly affecting the tropical and subtropical region. Which of the following test is used to diagnose the roundworm infection? A. Vidal test. B. Pap smear. C. Gravidex test. D. Stool test. E. Urine test.
B.
Yes.
D. Stool test.
MCQ number 6, soil transmitted helminthic refer to the intestinal worm infecting humans that are transmitted through the contaminated soil. Which of the following is important cause of iron deficiency anemia in children? A. Pinworm. B. Roundworm. C. Tapeworm. D. Whipworm. And E. Hookworm.
A.
Answer is E. Hookworm. MCQ number 7 is a 5-year-old boy was brought to emergency department with his guardian complaints of mass protruding from anus associated with pain, incomplete evacuation, bloody mucus, rectal discharge, the fecal incontinence. On taking history, parents said that they have been living in Kachi Abadi of Lahore in small house with poor sewerage system. Which of the following worm is involved? A. Pinworm. B. Roundworm. C. Tapeworm. D. Whipworm. And E. Hookworm. Answer is D.
A.
Whipworm. Whipworm. MCQ number 8, the farmers and gardeners are susceptible to hookworm infestation because of working in the barefooted and so having the direct contact with soil. All of the following statement concerning hookworm is correct except A, hookworm infection can cause microcytic anemia. B, hookworm infection is acquired by human when flariform larva penetrates. C, hookworm infection is caused by nectar americanus. D, hookworm infection can be diagnosed by finding the trophocyte. E, hookworm are intestinal blood feeding and parasitic roundworm. The answer is C. MCQ number 10, soil transmitted helminthes infection are among the most common infection worldwide and affected the poorest and most deprived communities. They are transmitted by egg. They are passed in the feces of infected people. Which of the following is not correct about their transmission? A, direct person-to-person transmission. B, larvae can penetrate the skin of the human. C, by drinking contaminated water. D, by eating raw fruits. E, by pica can also lead to infestation. So answer is A. Here's a key of MCQs. It is our YouTube link where the presentation are uploaded. Kindly like and subscribe. Thank you so much.